Good evening, friends. Welcome to this weekly edition of Miraculous Mondays, happening on the topics of practice management and medical legal ethics since the first week of Jan this year. So we are into the episode number 20 today. And of course, the endeavor has been to put across certain vital points to colleagues which can help them in one way or the other. So I hope my sessions have been a little bit of value addition to all of you, if not fully, at least partially. So in continuing with this endeavor in this aspect, I'll be dealing with a topic which I had taken up in session number 17 based on a medical legal case. So there was a revised complaint and there was further details available on that. There were a lot of assumptions made by us in that. Of course, most of them were not bad either. So I'll be discussing that page only. Before that, let me just check whether I'm live or not. Yes, it seems I'm live. Just a sec, guys. Okay. Yes, seems to me that I'm live. Yes, I am. Yes, the notifications do come in really late these days. Anyways, just allow me to share my screen and begin with the proceedings. So welcome once again. And I am before you as your host and host again on a beautiful Monday evening, sharing, you can say, the topic of practice management and medical legal ethics in this episode number week 20 of the 26 episodes that we have planned to take. So today is Monday, 16th May, and we are as usual on time to start the proceedings. So as usual, all my presentations always begin with thanking the Lord Almighty who's given me much more than what I deserve. And this is my brief CV by virtue of which I'm having a little bit of authority in sharing things with you guys. So this was the case on the left side, the bigger picture, bigger image that I had shared from a journalist who's a consumer activist as well. You can say exactly 3 weeks back in session number 17. So the same came up in a different newspaper yesterday, shared by a wonderful colleague from group number 5 from my WhatsApp community, Dr. Tejas Melkote, and he mentioned that although the details were not earlier available, and now they are. So I'll be sharing all the details of the case with you, and of course, I will be posting the same in my WhatsApp community, the case details or the case papers in the WhatsApp community as well, where I'm taking the sessions otherwise. So if anybody of you is not a member of my community, please let me know. I'll add you over there. So let's begin and just see, we all know if you have watched session number 17, as I have detailed in my community this morning, to watch that session again so that you know. There were a few pointers that I pointed out, of course, based on assumptions. Most of the assumptions that I had made that day were correct only. So, of course, the names have been very much clearly given in today's session. So, not a thing that can be, I can say, which can be denied over here. So, of course, in the live session number 17, the points discussed were the MLE consent part, whether it was taken or not, if taken, whether the communication was done to the patient or not, and about the record keeping snake. Of course, what was the reference point? Is the reference point visible, or the reference point set for the patient that yes, this is the situation, you are needing an ortho treatment, but as per your age, the patient is a 40-year-old female. She was not advised ortho treatment. Probably perio defects also, probably a few other things also, which have come to light in today's session. Of course, the clinical fancy scenario and so many other things that we have discussed. There were a lot of pointers which I discussed in that issue. The common errors, of course, which we make in medical legal, I discussed that. I won't be wasting much time on discussing the session number 17, since today's session is going to take about 30 minutes with you all today. So another mistake we do is the hurry in starting of the treatment in the clinic. Again, that turned out to be correct. No reference point to start with. Of course, they had pictures, as has come to light now, but no x-rays again came out true. Wrong diagnosis, maybe not. it is a difference of opinion sometime. Overlap of specialities, you will see at least 5 specialities are involved in this. And trust me, it is going to be a dentist killing a dentist approach in this. Then, of course, the expectation setting, the communication part where we convey what is going to be the situation. Most of the assumptions that I made in point in you can say session number 17 were correct only. Of course, without having a look at the case. So over promise and under delivery, yes, it was there. As I said, breach of trust by fellow colleagues, and especially orthodontists. If there was one on board, you will see there was definitely a breach of trust, and there was definitely an orthodontist, but orthodontist did not turn out to be a katappa. Who turned out to be katappa, or who killed the Bahubali? It was the dentist who is involved, Dr. Karthik Reddy, neighboring dentist. Again, one line which I have been speaking so many times in the past 5-6 years, never ever, you can say, have a conflict with your neighboring dentist. You never know when he might be sitting on the board. I've said this line at least a zillion times, if not a million times, of course. So, as I said, words like X-ray, IOP are still common, but words like HQ, high quality, long cone parallel radiograph, these are not common terminology. These have to come from a dentist. These don't come from anywhere. Of course, lack of consent, again, that thing is not clear, but what it seems, there was a verbal consent or a blanket consent kind of a thing. But yes, the patient was aware of the shade matching. But what the courts have done in this case is absolutely beyond comprehension. You will believe, you won't believe what they have done as I unfold the cases. And of course, after I finish the session, I'll be sharing the same in my WhatsApp community with all of you. And it is really frustrating to see that we as medical dental professionals are so much under the scanner all the time, and it is very difficult to work even sometimes. And if this kind of thing continues, we all will be forced to go, you can say, take up a safe-sided dentistry. If we go on to take up that approach, trust me guys, that will never be in the best interest of the patients. So this thing has to stop. But again, it was not by the patient. The patient, whatever it was there, it is patient's right to file a complaint. But it is, I'll say, the breach of trust by a fellow colleague. And the only thing I was wrong here was the orthodontist may have done the breach of trust, but orthodontist was not the katappa. So the medical errors will keep on happening, and we will get, you can say, a problem here and there many a times. But we need to be very, very sure that we understand the finer nuances of our profession. So let me just brief you a bit about what exactly happened. So we'll be discussing the case and the bane of contention, of course, in this case. What were the pertinent points of the judgment and what were the shocking points? And the only thing which came to the light in one single line for me, which is the title of today's session as well, the neighboring dentist colleagues, the neighboring dentist and backbiting. You can't blame anyone. We all indulge in this phenomenon and we all have to stop. Again, at least not billion or zillion, if at least a million times I've said, please do not backbite against your neighboring dentist. I have always said this line as well. I don't know, apart from the 23 subjects, yes, the branches are out of the all 6-7 subjects that you can say, if I count prosto as 3 subjects, the fixed as separate, removable as separate, and the complete dentures as separate, I'm counting them as 3. So we studied 23 subjects in final year, but 2 subjects which we did not study, but we remember, or rather we are a PhD in that, are subject J and subject BB, subject jealousy and subject backbiting. And again, those subjects always come to the fore. And of course, the hidden point in this is the professional rivalry, the lack of unity, and so many other factors. Chun chun ke kisi ki galtiyan nikalna as if we are perfect, it is a wrong approach, as you will see in the session as it unfolds. So this is the order. I happen to get the order, of course, from a site. I'm, you can say, using the ID of a fellow lawyer friend only to log into that site. Otherwise, it was a paid site. So I logged into that site and you can say went into that. I'll be posting the full judgment in the WhatsApp community. As I said, it is too, you can say, brief the text to study. But yes, I have given my observations to this. There are 7 pages which I'll be sharing after the session. So surely let's go ahead and tell you the main points. Of course, rather than you reading it, I'm telling you the main point. So the judgment starts with the fact that courts believe that smile is an important part. Without a smile, you don't have a confidence, you don't have a personality, you don't have a self-esteem. And as you know the history from session number 17, the complainant, Miss Anita, the patient's name is Anita, filed a case against Dr. Karthik Reddy of Telangana, then AP, Andhra Pradesh, against the permanent disfigurement of the face. The Consumer Forum, as usual, any court would do, refer to independent medical dental board. And in that board, there were 3 dentists. 2 opined that what was done was fine. But 1 opined that the treatment done was wrong. And she didn't, and it was a she. And she didn't say that it was wrong. She went on to say so many other things which I'll be unfolding before you. But the courts relied on the judgment of the majority and went away, and the complaint was dismissed. The aggrieved complainant, Miss Anita, again then went to the state commission. But there, the dentist, Dr. Karthik Reddy, was held as guilty, and it was allowed, the complaint was allowed in the favor, and he was again given that 5 lakh penalty and whatever mental trauma charges and whatever, and along with a 9% interest. This all started in 2008. I'll be giving you dates of that also. Many of you would be surprised. Sir, आप तो बोलते हैं कि medical record 2 साल रखने हैं, 3 साल रखने हैं, continuation or delay, limitation period, all those things. Nobody can file a case for eternity. यानी कि 20 साल पहले किसी ने treatment कराया, you can file a case. There is a limitation period. Limitation period is 2 years. 2 years from the date of treatment, anybody can file a case against you. 1 year plus is the continuation of delay, means Judge Saab, Maharaj, Your Honor, my Lord, can allow a continuation of delay up to 1 year. So 2 plus 1 is equal to 3. That is why the Medical and the Dental Council advise the records to be maintained for a period of 3 years with you. And of course, that holds good also. But in this case, the case is 2008, dated September 2008, and the charge sheet was filed exactly or less than 2 years after, in this state only, when the judgment came or when the news came, 14th of May 2010. Of course, charge sheet filed means it was a criminal case. So, of course, ये इंडियन जुडिशरी है भाई लोग, इसको टाइम लगता है थोड़ा सा. वो 40 साल का पेशेंट आज 54 साल का हो गया, डेंटिस्ट का भी पता नहीं कहां से कहां पहुंच गया, but the case is going on and they blame the doctors for everything. In this case, in the 3rd level, the patient, it is not mentioned whether the appeal was made against the state in the state itself or in the National Commission. But the patient argued herself. PIP, party in person, is allowed to argue in court if they don't want to hire a lawyer. They are given a free legal aid facility also in courts if they can't hire because of the economic reasons. There are multiple options in Indian courts. Baki wo hai ki competency kitni hoti, we never do that. But if the patient argued party in person, that means she was armed with something from her backhand. And who was the backhand? Of course, as situation turns out to be, probably the neighboring dentist only. So many things were same, as I presume that RCT was started the same day. Again, why are we in the hurry to start on the same day? 27th of July 2008, intentional RCT was advised in lieu of orthodontic treatment for proclination. So no time was given to think or plan or decide or discuss with family. That is probably a wrong thing. Of course, a consent form, if it was signed, it would have been a blanket consent, which is anyways not valid. Then the temporary caps or plastic caps, as has written in the judgment, were placed on 13th of August 2008. The difference 2 weeks too long. To wear for 60 days. Why? I don't know. But the patient feared losing them. It is but natural. No temporary crowns can retain for a longer period of time. Yes, occasionally they may, but on an average, the temporary semen does not last for this time. Why was this time given by the dentist? I don't know. So then impressions for PFM were made on 4th of September and PFM placed on 25th of September. Too long again, almost 2 months from the original date. Again, let's go away from the dates part. So the dentist version was a little different. That she was an old patient who had first visited on 10th of November 2007 for a decayed upper left back region multiple teeth. So I can presume that it is a 2728 removal. So if 2728 is removal, probably the periodontal health is also not very good. If the periodontal health is not good, why would anybody advise an ortho treatment? And if 2728 are being removed, any case, probably the ortho need goes slightly out of the window, especially when the 6 is the lone standing tooth. So of course, we haven't seen the case. That this is the kind of presumption we can make. But the patient again visited on 19th of July. Of course, the patient mentioned 27 July. The dentist had the front facial photographs of the patient apparently. And those showed the proclination of probably the lower teeth as per the photograph. But in the erstwhile patient, the judgment says the root canal was done on 2-1, 2-2, 2-3, and 4-1. An intentional RCT by an endodontist who visited Dr. Karthik's clinic, Dr. Shanu Kumar. So the court again referred to the medical board of 3 competent persons. This was done by the district forum. As I said, 3 people were referred to. 2 members had testified in favor in district forum, while 1, Dr. P.D. Annapurna, against. So but still the majority was prevailed. Since one of them was orthodontist, one of them was a cons associate professor, the orthodontist was a professor level, and Dr. Annapurna was a prosthodontist. So prostho, cons, and ortho guys were there on the panel, but ortho and cons were in favor. The prostho was against. So majority prevailed and complaint was dismissed as no negligence in the district forum. But in the state commission, going against the rules, again, why do Indian courts do it? They relied on the opinion of Dr. Annapurna, who's a prosthodontist and who has testified and mentioned that HQ, high quality, long cone, parallel beam, whatever. As I said, Ghar ka bedi lanka dhai. That is the only possibility of this. And she's mentioned the photograph cannot be relied upon for a RCT. And this is not the only thing that she mentioned. You will see the court ultimately relied on her points only. And the guys who had ruled in favor, they were given a different, you can say, light by the court. And the big bomb. Dr. Annapurna is the neighboring dentist of Dr. Karthik Reddy, and Karthik Reddy himself is a periodontist, by the way. Again, these, I normally don't disclose names, but since the judgment was there, we had to go in that part. So this is the way we are. So the 5 fundamentals which Dr. Annapurna gave to the court. See the Vibhishan Harkat by Dr. Annapurna. Wrong or right, you decide. But I don't think you can go to such a level to destroy a colleague. You can give an opinion, wrong done, right done, but you don't go to such a level to destroy a colleague. I'm really sorry. I am of the very strict opinion. एक dentist का सबसे बड़ा सगा है. Be it the neighboring dentist, be it anyone else. But if we can't be the kith and kin of our own fraternity, you can't be the kith and kin of your own family as well. It is very blatant. I would say that. Of course, everybody is entitled to opinion. This is strictly my opinion. So the 5 fundamentals that were relied upon court, the teeth have been ground beyond the requirement and tooth structure totally destroyed. Who writes that? Teeth disfigured that crowns can't be placed. अगर वो ज्यादा ग्राइंड नहीं हुए होते तो उनकी स्टेबिलिटी या ग्रिप नहीं लूज होती. उनको नहीं ग्राइंड करना चाहिए था. और देवी माता, ये ऑर्थो का केस था, इंटेंशनल आरसीटी किया था, तो ग्राइंड करना नहीं करना एक अलग बात है. यू आर गिविंग योर ओपिनियन in this sense. Still the teeth could have crowns via post and core, which was not done. The post and core should have been done, and ultimately the post and core turned out to be the bane of contention. Who put that in the judgment? Who put that in the judge's mouth, judge's ears? Dr. Annapurna. RCT wasn't needed as there was no apical pathology. And the worst part, the teeth or the body organs were unnecessarily killed and made non-vital without any reason. Number 3 and number 5 were the pertinent points which the courts took into account. Even the number 2 part, the grip and the vitality part. And if you're writing such things against your colleagues, no court would let any dentist go scot-free. No court would let any dentist go scot-free. It is for you to decide what do you want to do. The 2 other experts, I sorry, forgot to mention their name, an orthodontist professor and a conservative associate professor. They said ortho, if not done in that age, was justified. An orthodontist saying that, of course, vouches millions. I guess he would not have been IOS member or not. It is his choice. But yes, bravo, I would say. And intentional RCT was okay and satisfactorily done. So the endo part got a scot-free. Endodontist is okay. At least the endo part has been done well. There is no deficiency in the root canal. But what is the deficiency being made out of so many other things? By, of course, supported by the negating dentist. So, however, they mentioned, we are not aware about the communication part and the consent part. The doctor ने patient को बताया कि नहीं, communication था कि नहीं, written था कि नहीं. I believe mostly a blanket vote was taken if the same was started. So, Dr. Karthik Reddy, who was of course, the complainant or the revision petitioner against the state commission, he produced John Ingle as well to testify कि root canal किस case में करते हैं. To testify, of course, the Ingle gets a reference in the court case as well. Then the case was referred to Director Medical Education Andhra Pradesh also for opinion, who again opined, you can say that something may have been wrong. So this is a situation that we landed up with. And finally, 14th of May 2010, less than 2 years, within the limitation period, the charge sheet was filed. The sections mentioned are 338, 430, 506. I think 430 is wrongly printed because it is not a criminal section pertaining to medical law. So 336, 337, 338 are there, causing hurt, causing grievous hurt, and then causing grievous hurt by act endangering life is the most heinous section out of 336, 337, 338. मारा जोर से मारा, इतना जोर से मारा कि उसकी लात टूट गई या टूटने वाली हो गई. I'm just giving an example of the severity. मारा, बहुत जोर से मारा कि उसकी टांग टूटने वाली हो गई. So the third is the 338, 337, 336. So 338 was applied. 480 is usually cheating and dishonesty, of course, if it is with the unfair trade practice, which you'll see how. And of course, 430 can't be there because that is mischief by injury to works of irrigation or wrongfully diverting water. So usually that cannot be the case. And 506 is punishment for criminal intimidation. पुलिस का काम होता है ना ऐसे 2-4 सेक्शन लगाने so that the charge sheet becomes good enough and is approved by the district attorney so that it can be presented in the court. Once the charge sheet is filed, then only the case goes in the court. And before the charge sheet is filed by the court, upon the first, you can say, I'll tell you the procedure because I have been closely associated with this thing. Somebody goes to the court and files an FIR or goes to the police station, files a FIR. Sometimes they will register a DDR. Then if an FIR is registered, then the police begin the investigation. Immediate arrest is not allowed in cases below 7 years of imprisonment, as goes by the ruling of 2014, July 2014 ruling. I don't remember the ruling name. So automatic arrest is not there. So even these sections are not having arrest more than 2 to 3 years. So it was not done. So once the police finish their investigation by calling, you can say anyone by joining the investigation, or if someone is not joining the investigation, means a question answer session. So they can then ask for a judicial custody, or you can say otherwise a police custody as well. So once they finish the investigation, they file a charge sheet with the evidence, with all the annexures, and that is produced before the district attorney. And the district attorney signs it, and then it is billed as a court in the criminal cases. So these are all criminal sections. So then the court relied on the fact that orthodontists and con specialists were of opinion that RCT was good, but they were silent on whether it was needed or not. Of course, nobody would say whether it was needed or not. It was an intentional case. And if 2728 were missing, as per the patient's and the dentist's history, then you ought to have a good case that the perio condition was not that good also. But Dr. Annapurna said that postern court should have been done and the body organ damage was done vehemently. But then Dr. Karthik tried to mention that Annapurna madam is herself a prosthodontist and not an endodontist. So she can't, you can say, put her opinion about it. And also she is a neighboring dentist and trying falsely to implicate him. Of course, the court did not believe him. The endodontist, Dr. Shanu Kumar, was given a bye as the RCT was found to be satisfactory. There was no question whether the RCT was good or not. It was only a question whether RCT was needed or not. And then whether the teeth grounding part was done or the grinding part that was done was up to the level or not, that it lost the stability or the grip part. The main judgment which was relied by court was the Supreme Court judgment of Achyut Rao Haribhav Khodwa versus State of Maharashtra on 20 Feb 1996. ORS in court language means others. There may be multiple parties, so they write ORS. So the skill of medical practitioner differs from doctor to doctor. The very nature of profession is such that there may be more than one course of treatment which may be advisable for treating a patient. Courts would indeed be slow in attributing negligence on part of doctor if he has performed his duties to the best of his ability with due care and caution. Medical opinion may differ with regard to the course of action taken by a doctor for treating a patient, but as long as the doctor acts in a manner acceptable to medical profession and courts find that he has attended on the patient with due care, skill, and diligence, and if the patient still does not survive or suffers a permanent ailment, it would be difficult to hold the doctors to be guilty of negligence. It was an old case of 1969-70, Lakshman Trimbak Rao Gokhale versus IMA. That was a very landmark case in the medical negligence. I've shared that case in many of the consent sessions that I've taken. So again, in cases where the doctors act carelessly and in a manner which is not expected of a medical profession, then in such an action, in torts would be maintainable. Torts means a wrong, a civil wrong or a criminal wrong in that sense. So the dentist was given a bye from a permanent disfigurement. That permanent disfigurement did not happen because the crowns were prepared from the patient's impression, not he, from the impression, from the patient's impressions only. If patient का नाप अगर आपका मुंह ही टेढ़ा तो आपका दांत भी टेढ़ा ही बनेगा ना. They meant to say that. They didn't say it, but they meant to say that it was given a bye in that sense. So shade and shape form was signed by the patient herself in her handwriting. What is the shade? What is the color desired? So the patient was in sync with the treatment. But surprisingly, this point was not taken into account. Again, there was a contention of a PFM versus zirconia, a metal-free ceramic or metal ceramic crown. Again, this was the point which was contested, and ultimately the dentists were held guilty on account of unfair trade practices. Now that is where the consent form comes into picture. If you have your picture, if you have a treatment approval form, what you're signing, as I do in my consent workshops, if you have a consent properly signed along with the payment and the terms and conditions and the inclusions mentioned, there is no point in the patient backtracking from that. That is your vital evidence. What bigger evidence do you need that you are going in for that part? And Dr. Karthik's presumption that, of course, Dr. Karthik went overboard by saying कि वो patient का जो plastic cap निकल गया उसके बाद किसी ने उसके दांत और grind कर दिए ताकि उसको post and core वाला केस बना दिया जाए और उसको फंसा दिया जाए. Of course, he was referring to Dr. Annapurna, who was a neighboring dentist. Of course, when somebody is out to destroy you, people would retaliate. And he retaliated in this manner. Of course, the court did not buy that argument. Then he was held liable for deficiency and unfair trade practice on 3 counts. The court said complainant was a young lady, 40 saal ki young lady, very nice, and an MPhil student. But my lord, you have turned that 40-year after 2008 into 2022 into a 54-year-old young lady. So what were the 3 deficiency and unfair trade practices? No grip or stability. So it is embarrassing for the patient. Baat karte hue, talking, brushing, the crowns can slip. So the post and core should have been done. किसने डाला कोर्ट के दिमाग में पोस्ट and core नाम की चीज होती है? Neighboring dentist. Promised metal free ceramic but placed metal ceramic. So unfair practice. ये किसने डाला? ऑफ कोर्स किसी कलीग ने डाला पेशेंट के कान में. देन आरसीटी नॉन विटालिटी इशू नॉट कन्वेड वाज द कोर्ट्स कंटेंशन. कम्युनिकेट नहीं किया गया कि आरसीटी के बाद आपका दांत डेड हो जाएगा. योर बॉडी ऑर्गन इज डेड, योर बॉडी ऑर्गन हैज बीन डिस्ट्रॉयड. हु यूज दीज वर्ड्स? द नेबरिंग डेंटिस्ट. So the complainant, Dr. Karthik Reddy, in this case, he was the petitioner because it was a revision appeal. It is the failure of duty, deficiency in service, and unfair trade practice. Failure of duty to not convey communication. Deficiency in service, you did not resort to post and core and just did the fillings after, or maybe the core only. It needed post and core. And unfair trade practice. You promised metal free, but you gave metal ceramic. सारी टेक्निकल चीजें हैं. अगर ध्यान से देखो, पोस्ट एंड कोर टेक्निकल, मेटल फ्री जिरकोनिया टेक्निकल, नॉन विटालिटी डेड इशू टेक्निकल. Courts themselves say we are not competent enough to decide. Who bloody put it in their mind? We, the neighboring dentists. किसी को क्या करना, हम खुद ही अपने सबसे बड़े दुश्मन हैं. And these were the two last lines of the court judgment. And see what they rely on. The consensus between dentist and patient is essential to standardize treatment plans and methods. The line I have been saying, both the dentist and the patient need to be on the same page before the start. So many times I have repeated this line. In dental treatment, patients often ask orthodontists if they will look more beautiful and have doubts about the ultimate aesthetic efforts. Also, there is need to calibrate the perception between dentist and patient about the classification of aesthetic into unpleasant, acceptable, and pleasant. Maybe over promise and under delivery thing. हाँ मत, मैं आपको परी बना दूंगा, अप्सरा बना दूंगा, needs to be toned down a bit. Otherwise, there may be some conflicting views on expectations and treatment. That is why I always say, especially in the whitening treatments, in orthodontic treatments, in veneers treatments, the expectations need to be lowered down considerably. I've at least gone through 1,000 cases during my study of National Law School. 1,000 cases of negligence. And this all comes from experience. I've read all those cases way back 2008, 9, 10. And trust me, guys, ऐसे केस I was like this. यार क्यों इतना तो कोई मेडिकल प्रोफेशनल वाला लिख के देता है एक दूसरे के खिलाफ जितना डेंटिस्ट करते. So the teeth are only the part of the face, and it cannot be simply concluded that the whole face will become more beautiful once the teeth become neat. You may be having abrupt features, but if your teeth are great, does not turn you into beautiful. For example, of course, no discrimination. Maybe the Negroes, they're well-aligned white teeth. Sorry, no racial discrimination, just mentioning as a out of context. So they might be having rugged face otherwise, maybe on the darker side. They cannot be called beautiful sometimes, even if they have neatly arranged teeth, nicely arranged teeth, along with a whiter smile. So this was court's contention. So based on the aforementioned, opposite parties held liable for medical negligence and deficiency in service. The complainant suffered facial disfigurement after dental treatment. In our view, the compensation awarded by State Commission is just and proper. पर उनको लगा कि जो rate of interest उन्होंने लगाया है 9% का वो ज्यादा लगाया है, तो उसको modify करके उन्होंने 6% कर दिया. What a relief to Dr. Karthik Reddy. Thank you so much, my lord. So the only, you can say, expressions of Dr. Karthik Reddy would be like this only, of course. So this is from where we started. This was session 17 slide, and this is yesterday's case, which I have taken up in this, of course, with more details available. And of course, most of the assumptions that were made turned out to be pretty much correct only. So what is the carry home gyan for today? The one thing which I've been saying since so many years, dentist ka sabse bada saga hai. If you don't believe that, it is your choice. We both can save and destroy each other. And trust me, guys, if this continues, the future is going to be really tough with such scenes every now and then. And the communication plays an important role. We need to respect that and document that. Never be in a hurry to start. Always set a reference point. Give the patient the time to think. Why are we in a hurry to make the patient deposit in advance? in the first sitting. The patient is not going to run away. If he has chosen you for the big ticket case among so many in your area, he holds you in high self-esteem. He holds you in high respect. That probably this is the guy who can handle my situation. You don't have that faith on yourself. The patient has it on you. It is time to actually rewire your brain and shun out the illogical things out of your brain. Again, this was a slide I placed in session number 17 as well. Unity is another aspect which has to be addressed. And also the consent part. Don't think of patient running away. The consent is your savior most of the times. Of course, a reference point, the starting consent form, treatment approval form, and of course, your, I would say, the same page setting and the communication thing, that the patient and you were on the same page and you agreed upon the same thing in the same sense. That is what the code says. So understand and read the patient's mind, estimate the needs and expectations, and then jump onto the treatment. Don't be in a hurry. Don't be in a hurry. So this was the topic we were supposed to take up. Discussion of the case we did. The bane of contention in MLE is that someone from inside will always be the destroyer. And I've told you the judgment pertinent points. But the unfortunate thing is that, as usual, someone became a Katappa and killed Bahubali. That is the bottom line. So it is time to rewire, rewind, and you can say set your brain in the right order. If your brain cannot still comprehend what exactly is consent, people still ask me for consent forms. They still don't understand consent is customized. It is not fixed. It is not one form, one piece of paper is not consent. Please understand, it is a customized consent. I just finished a customized consent workshop, a month-long customized consent workshop. If it took a month for me to complete that workshop, do you think a simple plain of paper, a piece of paper will suffice for a consent? No, that will not. You will need to have all the inclusions in there. But I'm sorry to say the colleagues are not ready to even understand. Even today evening, I got a message from someone, please send me a consent form. They don't understand this point. Anyways, it is your choice. So if I have put you in a think mode, Jap Naam, Ashram season 3 is coming from 3rd June. My favorite, as I said. So of course, thank you so much. And if you are not a part of my community, I'll be sharing this case. Do let me know. This is an advertisement-free WhatsApp community of mine running since 4.5 years. Group 6 is on, and I plan to limit them till 6 only. The 6 has only few slots remaining. If you want to be added there, please send me a message. So this is my YouTube channel as on 10th May, 465 plus videos already there. Less than 2 years, all the hard work done from 1st June 2020 lockdown to this year. I'll be completing 2 years on 1st or 2nd of June. So this is the amount of hard work that has brought me, again, close to, you can say, develop this kind of content for all the colleagues. So do send me your feedback on my cell, on Facebook page, on WhatsApp group, wherever you're watching, on YouTube. This video goes on YouTube tomorrow. Anything you don't feel good, anything you don't feel bad, please be open to voice it. I am open to all kind of negative criticism as well. So Bookers and Brickbat both will be welcoming equally. So thank you so much. And I stop myself for questions or acknowledging the visitors on my FB page where this session is happening. Hello, Dr. Ramchandra sir. Hello, Dr. Girish Kurana. Hello, Dr. Rishikesh. Hello, Dr. Paramjeet. Hello, Dr. Nimish. Hello, Dr. Gurdev Singh Bali sir. Hello, Dr. Krishan Bora. Hello, Dhagash. Hello, Dr. S.P. Singh sir. Thank you, Dr. Girish. Thank you, Dr. Dhagash. Thank you, Dr. Ramchandra. Any questions? I'm here for 2 minutes, guys. Please let me know. I'll be very happy to answer them. But you have to understand one thing very, very clear. That consent needs to be a part of your repertoire, your part of your ammunition in this custom-prone era. This is a customer world. The customer used to be the king as well. It has been more empowering, more, you can say, empowered with Consumer Protection Act. And if you feel that the medical science or the dental profession is out of consumer protection, I think you are badly and sadly mistaken. You might have so many forwards on WhatsApp. but ask the person who deals with these things every now and then. We are not escaping from that, and we cannot do that. So those you can say things I have been telling you. So many things are already there on YouTube in the form of one session or not. There are so many playlists as well. So guys, just care to go through the playlist. I today morning I received a message from someone very close to me, and he said, "Sir, जितना कंटेंट आप फ्री में देते हो, उतना कोई पैसे दे के भी नहीं देता है। एंड स्टिल आप लोगों को घोड़े को पानी कुएं के पास जाना चाहिए। आप कुआं घोड़े के पास लेके आ गए हैं, लेकिन घोड़ा पिएगा तो खुद ही ना, उसके मुंह में तो आप नहीं डाल सकते हैं। But then this is left brain thinking, and it is illogical and irrational. That is what he said. He said the amount of work you are doing, the amount of things you are doing, the amount of free remedy and solutions you are providing in practice management, MLE, and finance, all under one roof. Probably I am one of the very, very few in India to deal with all these three together in dentistry, and apart from being a full-time practitioner as well. He said whatever you are doing, if people are rational enough, you would have been the most busiest mentor in this country, and you may have had to leave the practice. And I really mean it. And I was so touched by the feedback. I said I don't want to leave practice. So that is the reason I'm whatever I'm having in my limited sojourn or my workshop, I'm very much happy in that. So Dr. Girish, the WhatsApp group number was shared in the slides itself. Do go through the presentation. You'll find it over there. Sure. So thank you guys. Thank you, Dr. Harish Bhardwaj, for your valuable compliment. I see you on Thursday with another episode of Thunder Thursdays, episode number 20. Now we are into the 20s. 26 episodes are calling. I'll get free from this responsibility in 1.5 months' time exactly. So wow, I'm looking forward to it, getting over it, because I never leave things unfinished. So I wanted to give it up after 3 months, but then I said no. I'll continue what I've committed for 26 episodes. Thank you so much, guys, and keep watching. And surely I'll be back with another session of Miraculous Mondays next Monday, and Thunder Thursdays before that, episode number 20 on Thursday. Bye-bye. Take care. Have a great week ahead.